The Holmium laser is effective for two of the most common endoscopic applications in urology. These are the fragmentation of calculi and the incision or ablation of tissue. The Holmium YAG laser produces light at a frequency of 2100 nanometers, which can be carried by high-quality, low-water content quartz fibers. The energy is absorbed by tissue with penetration of less than 1/2 millimeter. This results in very well-defined tissue effects for either ablation or cutting. In addition, all types of calculi are efficiently fragmented by the Holmium laser. The VersaPulse Select contains two laser units, a neodymium YAG and a Holmium YAG. The entire device is controlled from a touch-sensitive display. Either laser can be selected. The energy level and duration can be selected for the neodymium YAG. When the Holmium is used, the energy level and pulse frequency can be set. The individual fibers can be attached through the SMA adapter. Appropriate eyeglasses for the neodymium or Holmium laser, or for both, are used during laser activation. In this presentation, we shall emphasize the features and application of the Holmium YAG laser in treating urinary neoplasms, obstruction, and calculi in the upper urinary tract. In this patient, we can demonstrate the use of the Holmium laser to fragment a cystine calculus in the mid-ureter. This stone was approximately 15 millimeters in diameter and had recently passed into the ureter, causing obstruction. There was also a 1 centimeter calculus in the upper pole of the same kidney. The patient was a known cysteinuric who had passed several calculi previously. The mid-ureteral calculus was approached with a small diameter rigid ureteroscope. It was clearly too large to retrieve, and the 365 micron laser fiber was passed into approximation to the calculus. Fragmentation was begun with the laser set at 0.6 joules with a frequency of 6 hertz. This was increased to 8 to 10 hertz with 0.8 or 1 joule during treatment to increase the rate of fragmentation. Irrigation was maintained through the instrument with saline. The vast majority of the calculus was broken into tiny pieces which were irrigated from the ureter. Other fragments were retrieved with a basket or a wire-prong grasper for assay. When the ureter was clear of all fragments larger than 1 millimeter, a guide wire was left in place to allow passage of a flexible ureteroscope to the intrarenal collecting system. The calculus was visualized in a papilla in the upper infundibulum. The tip was partially exposed with the remainder buried within the substance of the papilla. The laser fiber was again passed through the endoscope and applied to the calculus. The exposed portion was readily fragmented. The tissue overlying the rest of the calculus was incised with the laser without significant bleeding to obscure vision. The calculus could then be fragmented completely for removal. A total of 3.21 kilojoules was used for fragmentation of the two calculi. An indwelling ureteral stent was left in place for 1 week after the procedure. Follow-up ultrasound at 2 months demonstrated a normal intrarenal collecting system. A 62-year-old female developed flank pain and fever. On evaluation, she was found to have right hydronephrosis. A ureteral catheter was then placed beyond a mid-ureteral stone to provide drainage. After appropriate antibiotic therapy, the calculus was treated ureteroscopically. The Holmium laser fiber was applied to the calculus and activated at 0.6 joule and 6 hertz. Major fragments were broken further or removed with graspers. The entire stone was effectively removed. A ureteral catheter was left indwelling postoperatively. The Holmium laser can also be used for soft tissue applications. It has been effective for treating upper tract tumors by actual ablation. The limited penetration of the laser and its effect in removing tissue is particularly useful to clear the ureteral lumen of neoplasm. There is no concern about damage to underlying tissue. A 75-year-old female with a solitary kidney was found to have an intermediate-grade transitional cell carcinoma, partially occluding the upper infundibulum. She had been treated previously ureteroscopically, but had residual tumor along the anteromedial margin of the upper infundibulum. This portion of the collecting system could be accessed with a small diameter rigid ureteroscope. The laser fiber was applied to the affected region and activated at 0.8 to 1 joule at a frequency of 8 to 15 hertz. This allowed rapid removal of the involved tissue. The patient will be followed with cytology and endoscopy for persistent or recurrent tumor in the future. This 52-year-old female had multiply recurrent low-grade transitional cell carcinoma of the bladder. She also previously had a right ureteral neoplasm treated endoscopically. In follow-up, she was found to have an irregularity in the same portion of the ureter on retrograde ureteropylography. Endoscopically, this had the appearance of a low-grade transitional cell carcinoma. Biopsy demonstrated a grade 1 transitional cell carcinoma. After the initial biopsy, the lesion was treated with a Holmium laser. We can note that there was actual removal of tissue during the laser therapy. Treatment can be performed even at the level of the iliac vessels because of the limited penetration of the laser. In this 35-year-old female, a right ureteropelvic junction obstruction was demonstrated on evaluation for flank pain. One of the options for treatment was ureteroscopic endopylotomy. This has the advantage of minimal invasiveness while providing an adequate and controlled incision. Endoluminal sonography demonstrated no major crossing vessels. An incision was made posterolaterally with a Holmium laser through a small diameter rigid ureteroscope. For this procedure, the laser was set at 1.2 joules and 15 hertz. A very sharp incision could then be made through the entire thickness of the wall of the ureter. The remaining fibrous bands could be visualized endoscopically and incised further. A double pigtail stent was left in place at the end of the procedure and remained indwelling for several weeks. In this series, we have demonstrated several techniques and advantages of the Holmium laser in the upper urinary tract. It can successfully fragment calculi throughout the urinary tract. It can even successfully fragment stones such as cystine, which are more resistant to shockwave lithotripsy. It also can be used for the very accurate and controlled ablation of upper tract neoplasms and the incision of ureteral narrowings. It is a safe and effective device for many applications in the upper urinary tract.